Good afternoon. My name is Fadila Najim and I'm a radiation therapist at the Crown Princess Mary Cancer Centre, Westmead. Today I will be presenting to you how implementing follow-up phone calls has helped in identifying post-treatment side effects in our department. So this all started when we attended a conference at ASMR in Adelaide, and we saw a presentation by Mr. David Collier in 2011, and it was titled Mind the Gap. This presentation made a significant impact on many patient-focused radiation therapists in our department. It prompted us to think about what happens to our patients immediately after they finish treatment. The question we asked ourselves was, did we need to bridge the gap between the end of treatment and the follow-up appointment to maintain a continuity of care for our patients and to ensure that we could identify any post-treatment side effects following treatment? In 2015, patient follow-up calls were implemented as a valuable means of exchanging information, offering advice between the radiation therapist and the patients in regards to post-treatment side effects, as well as identifying patients in need of assistance and providing them with reassurance. While our aim is to bridge the gap between the end of treatment and the patient's follow-up appointment so that we maintain a continuity of care, the purpose of this study is to evaluate the effectiveness of implementing follow-up phone calls to help identify patients with post-treatment side effects in our department. So the processes we follow in our department are, an experienced radiation therapist schedules a follow-up appointment 10 days post-treatment for all patients that are over the age of 18, having radical treatment and speak reasonable English. When the call is made, a series of 8 questions are asked. The first 7 questions assess the patient's health status and ongoing radiation therapy side effects post-treatment, as well as the existence of a follow-up clinical appointment. And the final question invites any comments regarding their satisfaction with the phone call service. From the questionnaire, we were able to create a report in Excel and to evaluate our results. So the data was collected from a total of 850 patients between January 2015 and February 2016. The cohort included a total of 11 separate disease groups. The largest cohort of disease groups were breast, GU including prostates, skin and head and neck. The physical effects based on our results, a total of 28 patients reported they were not coping well. The physical effects of radiation treatment, the support needed and the fear of recurrence are all factors that contribute to not coping. As radiation therapists, we advise our patients at the end of treatment that their side effects will get worse before they get better, and they should subside within 2 weeks. We found that 26 patients reported that their side effects were getting worse post-treatment. We found that patients receiving radiation therapy to the skin, head and neck and breast were most likely to initiate contact with the hospital for assistance with concerns regarding skin. A total of 97 patients indicated they needed to contact the hospital, and we gave advice accordingly. 104 out of the 850 patients reported they needed more dressing supplies. So in our department, at the end of treatment, our nurses educate our patients about skincare, and they give them probably 2 weeks worth of dressing supplies so that they're able to do the dressings at home. So there were a number of comments also left by the patients that indicated that they had too much dressing supplies. So 104 out of the 850 is not that many compared to the group. Follow-up phone calls are a valuable service which help in maintaining a high quality of care and are an effective communication tool necessary to address patient-specific needs. This is evidenced with the 98% of our patients who reported they were happy to hear from us and that the telephone call made them feel like they were not forgotten. This project has confirmed the necessity of patient follow-up calls in a specific cohort of patients and has allowed us to investigate post-treatment care for radiation therapy patients. These calls have assisted in identifying and helping patients that are not coping well and have experienced worsening side effects. They have also helped in identifying patients that require further dressing supplies. For example, with breast, head and neck and skin patients that reported their skin reaction was getting worse with blisters and moist desquamation. We recommended that these patients come into the department and see the nurses to ensure the correct care was taken. For patients not coping well after treatment, the follow-up phone call identified health concerns which may have otherwise gone unreported by the patient. These patients were referred to their oncologist, which in most cases resulted in a pop-in visit, and this would ensure that the patient's concerns were catered to. The data we have collected has highlighted that extra work is required in ensuring patients with breast, head and neck, skin and GU are adequately supported through our services. Further investigation needs to be done into what information we give our patients now and what information we need to give to them in the future to ensure that our patients are able to look after themselves when they are at home on their own and have the correct numbers to contact if they need to. The timing of the follow-up phone calls for different groups may need to be analysed to see which groups require intervention sooner than others. Skin, head and neck and breasts may need early intervention as they had the highest reporting of side effects, getting worse and not coping. In our department, head and neck, GU and skin patients are followed closely by the medical team and often attend a review appointment or receive a phone call by the nurses at least 1 week post-treatment. Our results showed that there were still patients reporting that they did need to contact the hospital, which suggests that the follow-up call is still necessary for these patients. Palliative patients were excluded from our study. However, there is evidence to suggest that follow-up phone calls of palliative patients may have benefits to the patient and medical staff in busy clinics. This could be something we look at in the future. We also are looking at developing a plan which helps in accessing language resources such as phone interpreters so that non-English speaking patients can also benefit from our service. Through our research, we found that most follow-up phone calls are done by the nurses, and there isn't many literature out there to suggest that radiation therapists do this. So this has encouraged us to write our own paper regarding our project. Acknowledgements. So I'd like to thank the patient care group and my partner Susan Prosser, as well as Jill Harris, for always pushing us to excel in patient care, Katrina West, Rachel and Shamira, who helped me in collecting data and always there when I needed them, as well as the patients for allowing us to do the initial trial and now implement it in our department. Thank you.
Great, thanks very much. I'm going to kick off with the first question. When you do these phone surveys, you want to get as much info as you can from them, but you don't want to pester them. So you've balanced that at 8 questions. How did you get to that number 8 and choose those questions?
I guess when we all got together, the patient care group, which consisted of about, 8 to 10 members, we sat down and had a whole heap of questions, and then we reduced it down because we wanted to go back to ensuring that the questions we asked were based on the radiation therapy side of things, so we weren't over or double tasking with the doctors and the nurses and all that. So we had meetings with the nurses and the doctors, and we discussed things that they asked patients, things that the questions that they asked with their services, and then we brought it down to these 8 questions which focus solely on the radiation therapy side of things.
You mentioned at this one of the earlier slides that you had experienced RTs doing the phone calls. Got a couple of questions. Did you spend any time or feel there was a requirement to educate or support them as part of what they needed to do?
Yes.
And then also, did you evaluate their experience? Or did they provide feedback on their experience and their capacity to deal with some of the things that the patients were providing to them via that phone call? And also one more about compliance. You were looking at 10 days. Did you evaluate how well the RTs were able to maintain that compliance with that target?
Okay, so I'm going to answer. I'm not sure in which order, but in regards to the experienced radiation therapy making the call. So when we first implemented this in our department, there was a number of in-services that took place to train, I guess, all radiation, it was mandatory for all radiation therapists to attend. And we also trained, so by experienced radiation therapists, it's pretty much all patients that can do checks on patients that are starting. So in regards, so I guess it went on, like, I guess, as they asked questions, so we trained them in the sense that, okay, if it's skin related, we know that they see the nurses. If it's something relating to support or different side effects that they were experiencing, who to contact. I guess we just answered questions as they went, but most experienced radiation therapists, I guess, with years of experience, know how to handle this. What was the next one, sorry?
Just wondering about the RT's experience. Were they able to feedback? You've talked about the patient's experience of the questionnaire, whether you're able to evaluate the RT's experience in regards to having that as part of their day and part of their expanded skill set?
Yeah, so initially, so what happens is a task pops up and we make these follow-up phone calls. The follow-up phone calls are done by any radiation therapist. So the person that schedules the task is an experienced radiation therapist, but the person making the call is any radiation therapist. So at the start, we took feedback to see whether it was efficient to make these calls in that time frame, and we found, based on our earlier study, that there was probably about 5 patients that were contacted on each machine per week. So it was quite efficient.
And they were able to do that in that 10 days?
Yeah, they were. They
Yep.
were. Yeah, I guess it's become such it's a process in our department that we don't even think about how much time it's going to take. It's just done. It's become a norm.
Great. No more questions. Thank you.